Hello. Today we will take a detailed look at the aesthetic restoration of a premolar under the operating microscope. The tooth is already prepared and isolated with a rubber dam. A sectional matrix with a green fixing ring is placed to restore the contact point. We start with the proximal box. We place the first increment of composite, followed by flowable material from a syringe. To perfectly adapt the composite and prevent void formation, I use a fine endodontic file. This allows the material to fill all microspaces. Next, using a modeling spatula, we shape the proximal wall, carefully pressing the material against the matrix. After the wall is built, we move on to the occlusal surface, adding the next increments of composite. To create natural anatomy, cusps and fissures, I use a fine pointed instrument. We build the relief layer by layer. To make the composite surface perfectly smooth and ensure seamless transitions, I periodically use a microbrush. Every millimeter is meticulously refined to accurately replicate the natural pattern of the tooth. At the end of the video, you can see the final result after removing the rubber dam. We achieved a perfect anatomical restoration that harmoniously integrates with the natural tooth structure.